My name is Lars Andersen. I work at the Aarhus University Hospital in Denmark. So although this is a sort of an abdominal section, I have focused a little bit more on lactate in general. There will be a little bit about its relation to some of the abdominal complications, but it will be a broader talk about lactate in connection with cardiac surgery. And with cardiac surgery, I mean sort of major cardiac surgery. Most studies are on coronary artery bypass grafting, valve repair, valve replacement, and of course a few studies on heart transplant. But I do think these translate to other types of more specific cardiac surgery as well. So I don't have any disclosures. The background for this talk are a few narrative review articles we did a few years ago. This one is about lactate in general for internal medicine, ICU, emergency medicine. And then a more specific paper a few years ago in anesthesia and analgesia about lactate after cardiac surgery. The reason why I put them up here is because all the references and sort of more details can be found in these two articles. So there won't be any references, not a lot of references in this material, but they can all be found here. The second one is a little bit more systematic, and there's a lot of detail in the supplements material as well. So the first question is, where does lactate come from? And it seems like a simple question for something we have been measuring for more than 50 years. It's actually quite complex, and there's still, to this day, research going on about what are the actual mechanisms for elevated lactate. This is what we are taught in medical school and is still the sort of most used approach, or the most approach that's most accepted. Fairly simple graph here showing that glucose turns into pyruvate, and if everything goes well, it goes down to acetyl coenzyme A, down to the Krebs cycle, the TCA cycle, and the electron transport chain, and oxygen is converted into ATP. That's if there is enough oxygen, and then the other option is that pyruvate can go into lactate. There are other mechanisms or sort of newer theories, but this is sort of the basics. So the traditional approach, and this has been the approach for at least 50, maybe even 60 years, is that this is the reason why we have elevated lactate. It's a matter of decreased oxygen delivery. So from this figure, it's quite logical that if you don't have any oxygen, well, then you have a buildup all the way here, and then pyruvate turns into lactate. So what causes decreased oxygen delivery? Well, obviously there's hypoperfusion or shock, so decreased perfusion. There could also be very severe hypoxia or anemia. And then some more recent consideration that some of it could be peripheral shunting, or more generally microcirculatory dysfunction. However, in the last maybe 10, 15 years, there's been a decreased focus on other mechanisms for increased lactate. So that's decreased oxygen utilization. So that's a condition where there's actually plenty of oxygen, it's just not being utilized. And that can be due to defects in the electron transport chain, in the TCA cycle, all the way up here to the pyruvate dehydrogenase, which is this enzyme here converting pyruvate into acetyl coenzyme A. Another newer mechanism is increased metabolism. So if we have an increased flow in general, glucose turning into pyruvate, we will also have an increase in lactate. And then of course there can be decreased clearance, but most studies suggest that probably plays a minor role also in the post-surgical patient. So is lactate elevation in cardiac surgical patient an oxygen delivery issue? Well, maybe. I think it's very hard to answer that question. As I said, despite a lot of research, this is some of it. And as you can see, some of it is fairly old. This is from the 90s, some from early 2000s. This one you can see I actually had to go down to the library basement and do a photocopy. That's why it's this not straight. And that's just to illustrate that there are a lot of studies, some in minor journals, some are in older, and it's all over the place. These studies over here generally favors that oxygen delivery is not an issue, whereas these studies over here favors that oxygen delivery is